Hello everyone, my name is Dr. Lee Tjen Jhung and you can call me TJ for short. I'm actually a heart specialist and I work at the National Heart Institute. If you've seen along Jalan Tun Razak, it's a big yellow building. So our main objective there is to treat as well as to prevent heart disease. As many of you probably know that heart disease is one of the main illnesses affecting many Malaysians as well as other people worldwide. I believe many of us might have had a family member or a friend which probably has had heart disease in the past or is under treatment right now. And as such, many of you probably have questions about heart disease which I'm happy to answer today. Cardiovascular disease remains the number one killer of Malaysians. It has been this way for many years. And a close number two is actually cancer, and number three would be stroke. Now, cardiovascular disease includes things like heart disease, heart attack, heart failure, and even abnormal heartbeats. The average age of people getting heart attacks in Malaysia is actually 55 years old, around the age of retirement. But the youngest patient I've had to treat for a major heart attack was actually 25 years old. Thank goodness he's doing very well right now. It actually just shines light on the fact that many people actually suffer and die from cardiovascular disease. Did you know that more people die from heart disease every year compared to COVID? So it is important that many of us know further about heart disease. Cardiovascular disease such as heart disease and stroke all come from the same issue, which is narrowing and blockage of blood vessels. So if you have a blood vessel and eventually it gets smaller and smaller and smaller, the blood flow within it will actually get less and less and less. Up to a certain point, the blood flow is insufficient, not enough, and then the tissue being supplied by that blood vessel will have compromise of its function. In other words, it will be damaged. Damage in the heart will lead to heart attack, and damage in the brain will lead to a stroke. So we understand now that narrowing and blockages will cause heart attack and stroke. But what causes the narrowing and blockage in the first place? Many of us will actually come to realize that the blockage comes from a result of lifelong habits that can lead to diseases such as hypertension, diabetes, and high cholesterol, obesity, smoking, lack of exercise, excessive stress, and all these factors combined can lead to narrowing of the blood vessels and eventually blockage, which, as I said, would cause damage, also known as heart disease or stroke.